My name is Tom Synan. I am the police chief for the village of Newtown. I sit on the Hamilton County Heroin Coalition, and I'm also the director of the Hamilton County Heroin Coalition Task Force.
What do you think is the most important thing that people know about heroin?
The most important thing to know about heroin is, number one, it knows no boundaries. Heroin could care less what the color of your skin is, how much money you make, where you live, what religion you believe in. Heroin has really impacted every aspect of society. And I think that's one of the things that makes this drug so different, is that it doesn't matter if you're lower, middle class, or upper class, it has impacted everyone. And the other thing with it is how extremely addictive it is. And I don't think a lot of people understand how the body changes and how the brain changes and how the chemicals in the body and the brain change when they're on an opiate or heroin.
What are the laws on possession and distribution on heroin?
Well, the laws are kind of, if you have what we call a bulk amount, currently it's 250 grams. There's a bill in the Ohio House right now to lower it to 100 grams, which we believe that's probably what will happen. That would be considered bulk, and that would be a higher penalty. Now, the possession and for dealing small amounts right now is almost the same. It could be a felony in the 5th degree or a felony in the 4th degree, which is generally probation-oriented, not necessarily mandatory jail time. So one of the things that I've been kind of vocal about, and a few of us, not just in the law enforcement community, but in the community as a whole, is separating the possession and the dealer. It is my personal opinion that those dealers are selling something that they know is highly addictive. But they're not just selling the heroin, which is highly addictive, they're also using fentanyl, which is not just highly addictive, but highly deadly. So it is my opinion that even if you sell a small amount, a half gram or a gram, that street level deal, which most of these people are buying, they're buying the half gram or the gram at a time. Your general user isn't necessarily buying 250 grams or 100 grams. That's the person who's splitting it down and middleman and splitting it down and then breaking it down to the street and selling it. So my thing is that dealer knows what they're doing. It is intentional. Their acts are deliberate. So for me, I believe they should face stiffer penalties. The user, on the other hand, is truly the addict, then that is something we need to deal with on another end. And I think there can be separation. A lot of times when you discuss this issue, it ends up being that, well, we just focus on the amount itself and then say it's one blanket issue or one blanket answer. And in my opinion, actually, I think we can separate this and make it both. If you're going to sell heroin for the $20, $30, $40 at a time, you know heroin's deadly, you know fentanyl is deadly, you should face a stiffer penalty. If you're an addict and you're using, then you should go to treatment. So it's one of the things we're looking at, but you know, the whole thing with heroin is an extremely complex issue. And even on a simple tidbit of that, you would have to break down, then we started making some decisions on ultimately who's in jail and who's not in jail. So every time we open up this Pandora's box, it just keeps getting bigger and bigger and bigger. And when we think that we have a solution, we're finding another stumbling block. But the thing is that we're getting out there, we're talking about it, we're discussing it, and all these issues are now out in the open, where before they were behind closed doors and not even discussed. So for me, my perspective is that this is what's making this work, and what's going to work is the more we talk about it, the more we get out in the open, and the more we debate this, not just criticize or judge, but actually debate it with an open mind, I think we'll find answers.
Do any of your officers carry Narcan?
Yes, all of our officers do. So part of, and actually with the complexity of the whole heroin issue, this was the simplest issue. Sitting on the coalition, we discussed issuing Narcan to police officers, firefighters, first responders. And as complex as everything is, this was the simplest answer for me. Our job is to save lives. So for me, it was a matter of let's try to get Narcan in first responders' hands, police officers' hands, because our job is to save their life, and we have this tool to save their life. It's not a matter of us judging why they got in the position they did. No other aspect of this job does society ask us not to intervene. Like if someone was trying to commit suicide, they would say do all you can to save their life, even if you risk yours. If someone had a couple drinks and got into a car accident, they'd want us to save their life. Someone who smoked forever, they'd want us to save their life. Now the debate becomes, well, those things may be, on face surface, may be legal, where heroin isn't. I think for us, it's not a matter of whether it's legal or not illegal, it's about humanizing that person. That person went out to buy that heroin because they're addicted. They didn't have the intention of buying it thinking that they were going to die. Our thing too is if you understand the heroin addiction itself, the average addict, it takes 7 to 8 times for them to make it through rehab. The average heroin opiate addict, it takes 1 to 3 years for the brain to be rewired off of that opiate. So understanding that, the issue for Narcan for me becomes every time someone gets Narcan, it's another chance that they live. It's another chance that maybe that rehab works. But it's even more important than that. Even if you don't have compassion for that person who is suffering with addiction and suffers that overdose, every time you stand over as a police officer, someone who overdosed, you're standing next to someone who's grieving, a family member or a loved one. And when you look down at that person, you realize that's somebody's mother, father, brother, sister, husband, wife. And for me, if an officer or first responder can give that person Narcan, that's one more day that that family has a chance to get them into rehab. That's one more day that family has hope. And if nothing else, it's one more day that they don't have to grieve. So the Narcan issue for me is simple. Get it out to the officers. Our officers are carrying along with over almost 800 police officers in Hamilton County from varying agencies, from Harrison to Green Township to Norwood to Newtown and Sharonville, and several more are carrying Narcan, and to me that's a good thing.
What can someone do if they suspect a user or a dealer is in their neighborhood?
Well, what they can do is call. There's a couple numbers you can call. There's several drug units. One of the numbers we've been pushing out is 352-DOPE, which is the Hamilton County Sheriff's Department's Renew number, their drug unit. And also we have a number for the task force, the heroin overdose task force. This task force is different. It investigates overdose deaths backwards, trying to hold those dealers or people in that chain accountable. So if someone has information on an overdose or an overdose death, we're asking them to call 946-4411, and that's the task force phone number. Here's the thing that people got to understand is when you call in a tip, we have to have probable cause to move forward. So what it does is it puts that incident on our radar. And then departments, the police officers are going to try to get the resources and then try to surveil that, use other tactics to try to build that probable cause. If they can build that probable cause, and then we can make an arrest. But it's the public who is the ears and the eyes for us. And if they can give us that information, it allows us to get that on the radar. And what we're finding is often when you're talking about these dealers, they're connected. So even if we can't do something on your tip right now, what we see ends up happening is on the back end we find out they're involved in something else and then we can do something. But it was all because someone called it in and put it on our radar. We would have never been able to connect the dots without the public.
What's working to get this problem under control?
Well, I think what's working here in Hamilton County, and I strongly believe this has been a foundation built. So about a year ago, the Hamilton County Commissioners and Prevention for Health, Interact for Health, Board of Health, Mental and Addiction Services, Talbot House, the law enforcement and fire and EMS and medical community got together. And we established the Hamilton County Heroin Coalition. And what's so different about this is in the past I described that law enforcement was doing one thing, fire and EMS doing something, medical doing something, elected officials doing something, prevention, treatment, we're all doing their own thing. We were all trying to make a difference. But what we weren't doing was necessarily connecting with each other and telling us where obstacles were, where we were seeing voids. So what this coalition does is now all of us sit at a table. And it's not just representatives, it is the heads of these agencies. Sit at the table and say, this is a problem, how do we fix this? Or we need this resource, how do we get it? Or we don't have money for this, how do we find this out? Or the public doesn't know about this, let's make sure we get that information out. That is the foundation, and from that foundation we've been able to kind of spring other projects off of it. From the law enforcement end, we've been charged with a supply reduction, but we've taken a different philosophy in law enforcement, knowing that we can't just reduce the supply, because even if you reduce the supply, the demand's still there. And you can't just reduce the demand, because if you still have the supply, you're going to have demand. So we've been taking this unique approach with this task force, and like I said, they investigate deaths backwards, but what they're also doing, they're the ones on the street. And they're intervening with these people. When people need help, they have someone who they can contact. And now, because we have all these connections, that officer that's investigating that death and finds someone that needs help has a direct line to the treatment center. It can now get that person help right away. And actually, that's probably one of the most important things that that's come out of this, is we have a direct line where before, there might have been a waiting time. Someone would have to wait 2 to 3 weeks for a bed to open up. Now we have a direct line and people are finding them help right away, instantly. Because we find if we can help them right away, we have a better chance of getting them in recovery. So I think we've laid this strong foundation down. It's only been a year and we've accomplished so much. The other key to this is that we're all working together. And you hear a lot of people say, well, they should work together, they should share this. I'm telling you, this is sharing information. This is working together, sharing resources like I've never seen before. All these parties have come together for one goal, and that's to stop the epidemic of heroin. And because of this foundation, I'm convinced that we'll be able to do that. It's not something that happened overnight. We're not going to be able to fix it overnight, but we think within 5 years we should be able to make a strong difference. And again, you got to figure if it takes 7 to 8 times for someone to get out of rehab, or 1 to 3 years to change the wiring in their brain, then you have to allocate that time within that when you want that resolution. And we think that our plan is going to be able to do that.
What can the public do to help?
The public, one, is educate themselves. There's been many forums put out. If you hear of an event, a forum being put on, please go to it. The one thing that we're trying to do with the public is get the information out to them. And here's the thing that we're doing, is we're being extremely honest. You will hear the good, the bad, and the ugly. And the purpose is that the public always finds the answers. The public dictates what elected officials should do. The public dictates what policies the police department should use. The public dictates how we as a society look at other people. And we're trying to humanize this issue. We've learned that zero tolerance doesn't work. What you say with zero tolerance is basically, even though there's other factors, there may be other legitimate reasons, I don't care what they are, you shouldn't be doing it, period. What we're trying to do is change that mindset, because it hasn't worked. Trust me, we've tried, and we're where we're at now. So what we're trying to do is tell the public, hey, go into this with an open mind. Compassion on both ends. We can still be strict with people and still have compassion and say, hey, my compassion is that you're going to have to follow this law, you're going to do what we as a society say you should be doing. And compassion on the other end, hey, if you got this issue and you're addicted, then we need to try to get you help. The public has a strong say in that. And by coming to these forums, we can debate those issues, we can talk those issues, and we can find answers with that. And also always be the eyes and ears of law enforcement, and not just law enforcement. Reach out and try to figure out, how can I get involved in treatment? How can I volunteer? How can I help? Because you find that the heroin issue is a springboard to many other issues, from mental health to economic issues to social issues. And that's where the public gets involved. And actually, my personal opinion is that once the public really gets involved in this, then we'll end up solving this.
Is there anything else you'd like to add?
The only thing I'd like to add is there is this perception that this is not going to end. There's this perception that we're overwhelmed. And I'm not going to lie and say that it's not a daunting task. But what I will say is that with the Heroin Coalition, with the task force, working with the Board of Health, with mental and addictive services, the Prevention First and Interact for Health and elected officials, I honestly believe we have a foundation set that'll make a change. And I always get this question of, okay, well, let's say you fix heroin, but then a year or two down the road a new drug comes out. I think that we've laid the groundwork now that not only can we deal with an issue like heroin or another drug, but we can now deal with these issues that encompass the entire communities, not just individual communities, but the ones where the boundaries are broken down. And I think we actually have a foundation for that, and that's what I'm so optimistic about, is with this foundation we'll be able to not only change this, but what happens in the future.